High cholesterol is a sneaky condition that typically develops unnoticed in people over 40 and only becomes apparent when irreversible vascular problems have already developed, which can only be addressed through surgery. However, there are non-specific early signs of high cholesterol that can warn you that it's time to urgently adjust your lifestyle. Let's take a look at them. Early symptoms of high cholesterol: general fatigue, decreased energy without apparent reasons, especially in the afternoon. Headaches or heaviness in the head, arising from emerging problems with brain blood vessels. Dizziness or darkening of vision, which may be associated with impaired blood microcirculation. Occasional chest pain or discomfort that may occur during physical activity. A feeling of heart palpitations not related to emotions or physical activity. Mild shortness of breath with light exertion is the first sign of deteriorating vascular elasticity. Cold extremities, a feeling of coldness in fingers and toes, which is associated with poor circulation. Tingling or slight numbness in the limbs may occur after prolonged sitting or sleeping. Deterioration of skin condition, dryness, loss of elasticity, early wrinkles due to impaired blood microcirculation. Small spider veins on the legs, back, or face. Mild distractibility. It becomes harder to focus on tasks. Episodes of forgetfulness, such as forgetting small details and events. Occasional feelings of heaviness in the right upper abdomen may indicate a disturbance in fat metabolism and liver overload. Frequent episodes of bloating and abdominal discomfort after fatty meals. If you notice at least 2 or 3 of these signs, you should get a blood test that shows lipid levels, a lipid panel, or lipid profile. It helps assess the risk of atherosclerosis, cardiovascular diseases, and metabolic disorders. What is a lipid panel? A standard lipid panel includes total cholesterol, bad cholesterol, good cholesterol, and triglycerides. Let's break down what each of these means and how to interpret the test results. Total cholesterol. As we know, there's good cholesterol and bad cholesterol. Total cholesterol reflects the sum of all types of cholesterol in the blood. Interpreting the test results. A reading of less than 5 millimoles per liter is considered normal. Total cholesterol between 5 and 6 millimoles per liter is considered elevated. A level of 6 millimoles per liter or higher is associated with serious risk to the heart and blood vessels. It's recommended to see a doctor immediately. Very low total cholesterol, less than 3 millimoles per liter, can occur in people following strict diets or those with liver or thyroid diseases. Total cholesterol provides useful but incomplete information. The next indicator is of key importance. Bad cholesterol. In reality, cholesterol isn't divided into good and bad. It's always the same. Only the blood proteins that transport it are divided into 2 types. The first type of protein delivers cholesterol from the liver to each of our cells. This is what we call bad cholesterol. The second type, on the contrary, removes excess cholesterol from blood vessels and cells and carries it back to the liver, from where it's eliminated from the body in bile. This is good cholesterol. When there's too much bad cholesterol, it starts to settle on the walls of blood vessels, forming atherosclerotic plaques. As these plaques grow, they start to impede blood flow through the vessels, causing the symptoms we listed at the beginning of the video. What result is considered normal depends on your health condition. For people diagnosed with atherosclerosis, or those who have had a heart attack or stroke, a safe level of bad cholesterol is considered to be less than 1.8 millimoles per liter. For people at increased risk of cardiovascular diseases, a level of less than 2.6 millimoles per liter would be considered safe. For healthy individuals, the upper limit of normal is 3 millimoles per liter. A reading between 3 and 4 millimoles per liter requires lifestyle changes. We'll explain what these changes involve later. In some cases, medications are prescribed. A level between 4 and 5 millimoles per liter indicates a high risk of cardiovascular disease. Medications are most commonly prescribed in this case. A bad cholesterol level above 5 millimoles per liter is a dangerous condition with a high risk of heart attack, requiring immediate medical attention. In rare cases, usually in people following low-fat diets or those with underlying medical conditions, a lower level of bad cholesterol is detected. A level below 1 millimole per liter is considered excessively low, and less than 0.55 millimoles per liter is dangerous, requiring urgent medical attention. Good cholesterol. These proteins are true nanocleaners, sweeping excess cholesterol out of our blood vessels and protecting us from atherosclerosis. Good cholesterol reduces inflammation in blood vessels, maintains their elasticity, improves blood flow, and prevents the development of hypertension. The normal level for men is more than 1 millimole per liter. The normal level for women is more than 1.2 millimoles per liter. If good cholesterol falls below these numbers, the doctor will note insufficient protection of blood vessels and an increased risk of atherosclerosis. A level greater than 1.5 millimoles per liter is considered optimal for both sexes. In rare cases, excessively high levels of good cholesterol, more than 2.5 millimoles per liter, are found. This may be associated with liver disorders, lupus, or rheumatoid arthritis. Triglycerides. These are fats that enter the bloodstream from the liver and serve as a source of energy for cells. Triglycerides themselves do not deposit on blood vessel walls, but at elevated levels, they provoke inflammation in the blood vessels and promote the growth of cholesterol plaques. Interpreting the test results. As shown in the table, normal triglyceride levels should not exceed 1.7 millimoles per liter. Levels between 1.7 and 2.3 millimoles per liter indicate a risk of cardiovascular disease and type 2 diabetes. At levels between 2.3 to 5.6 millimoles per liter, the likelihood of most cardiovascular diseases, pancreatitis, and type 2 diabetes increases. A doctor's consultation and a review of diet and lifestyle are required. Triglyceride levels above 5.6 are considered dangerous, with a high risk of cardiac events, pancreatitis, fatty liver disease, and severe metabolic disorders. Low triglyceride levels are usually not dangerous, but a reading below 1 millimole per liter may indicate nutrient absorption problems or chronic diseases. Why are all lipid profile indicators important? Sometimes people have misconceptions about lipid profile parameters. Some people think total cholesterol is the only important factor. Some focus on bad cholesterol, dismissing other indicators as less important, but this is a serious mistake. Researchers from Boston University found that people with high triglyceride levels, more than 1.7 millimoles per liter, and low levels of good cholesterol, less than 1 millimole per liter, have a very high risk of developing coronary heart disease, even if bad and total cholesterol are within normal limits. How to properly take a lipid profile test? For a lipid profile, blood is drawn from a vein in the morning, on an empty stomach, 12 to 14 hours after the last meal. The evening before, have a light, low-fat dinner. Refrain from smoking, eating, and drinking for 2 hours before the blood draw. It's okay to drink a little plain water. Do not consume alcohol for 24 hours before the test. Try to avoid emotional and physical stress for 1 hour before the test. Atherogenic index. So, we've determined the levels of good and bad cholesterol, but for a more accurate assessment of cardiovascular risk, we also need to know their ratio. For this, doctors worldwide use the atherogenic index. It is calculated using the formula you see on the screen. An atherogenic index of less than 3 is considered normal. A result between 3 and 4 indicates moderate risk. Above 4, the risk is elevated. Let us look at an example. A person's tests showed total cholesterol of 4.5 millimoles per liter and HDL of 1 millimole per liter. If we plug these parameters into the formula, we get a result of 3.5. This is clearly a high index, which means that a person with these parameters needs to change their lifestyle, at the very least. What should you do if you have symptoms of high cholesterol, but your lipid profile is normal? This happens quite often, and there can be various explanations for this situation. The symptoms listed at the beginning of the video are common not only to high cholesterol, but also to stress, vitamin deficiencies, and other conditions. You may not have followed the preparation guidelines for the test, in which case you should retake it. Besides high cholesterol, vascular problems can arise due to hypertension, high blood sugar, excess weight, and genetic factors. We can conclude that you should not try to diagnose yourself. Even with a normal lipid profile, you should consult a doctor. Lifestyle modifications. Each of these recommendations will help normalize your lipid profile, reduce the risk of cardiovascular diseases, and improve your overall well-being. Physical activity. Aerobic exercises improve the atherogenic index. Moderate strength training improves lipid metabolism. Weight control. If you are overweight, even a small weight loss of just 5% of your body weight can significantly lower your triglyceride levels. And losing belly fat normalizes the ratio of good to bad cholesterol. Quitting smoking is crucial, as smoking increases the level of oxidized cholesterol, which is most harmful to blood vessels. Stress management and sleep. Lack of sleep disrupts metabolism, and the stress hormone cortisol increases the release of fatty acids into the bloodstream. A sleep routine, yoga, meditation, and breathing exercises can help address both issues. Dietary recommendations. A well-balanced diet plays a crucial role in improving lipid profile parameters. Increase your intake of unsaturated fats, especially omega-3 fatty acids. They normalize triglycerides, increase vascular elasticity, and reduce the risk of blood clots. Limit sources of saturated fats. They raise the level of bad cholesterol. Avoid sunflower and corn oil. They contain excessive amounts of omega-6 and almost no omega-3. This imbalance contributes to chronic inflammation. Completely eliminate trans fats. They promote the formation of the most aggressive forms of bad cholesterol while lowering good cholesterol levels. Regularly consume soluble fiber. It helps eliminate cholesterol from the intestines. Avoid foods that cause sharp spikes in blood sugar levels. They damage blood vessel walls. There is a popular belief that small amounts of dry red wine increase good cholesterol. However, scientific studies have shown that the effect of wine is greatly overestimated, and any potential benefits are outweighed by the overall harm of alcohol, especially with long-term and regular consumption. Excessive salt consumption increases the strain on the heart and blood vessels. While the recommended daily intake is 5 grams, modern people consume 2 to 3 times more, with most of the salt coming from processed foods. Potassium balances the effects of salt. It lowers blood pressure and dilates blood vessels. Consume magnesium. This mineral improves the balance of cholesterol and triglycerides and reduces the risk of diabetes and hypertension. Try to fry food in a pan as little as possible. Steaming and cooking in a home electric grill are considered the best methods of heat treatment. Let us sum up. High cholesterol may not show symptoms for a long time, but it can lead to serious problems. Symptoms indicating an abnormal lipid profile often appear only after advanced changes in the blood vessels have already occurred. The only reliable way to detect the problem early is to get a blood lipid profile test. For adults under 40 without risk factors, it is recommended to get tested once every 5 years. For those over 40, once a year. Cholesterol can be managed. The key is to take action early.
This content is for informational and educational purposes only. Consult with a doctor or healthcare professional before following any recommendations provided in this video. Tell us about your experience in the comments and subscribe to our channel.